next bill in the queue. Item number 4, AB 309, Zbur.
Madam Chair, members, I am proud today to present AB 309, which will support California's comprehensive strategy to prevent the spread of HIV and viral hepatitis by preserving existing laws that increase access to sterile syringes. After decreasing for almost 30 years, HIV diagnoses began increasing again in 2021 and 2022. The sharing of used syringes remains the most common mode of transmission of hepatitis B and hepatitis C, and the second most common mode of HIV transmission. These diseases are both potentially deadly and extremely costly. The estimated lifetime medical cost related to HIV treatment for just one person is $326,500. After 20 years, extensive research and data collection has repeatedly proven that increased access to sterile syringes significantly lowers rates of transmission and saves lives without increasing rates of drug use. AB 309 will ensure that our state maintains critical public health tools. First, removing the sunset date on the statute, which allows pharmacists to sell syringes without requiring a prescription. And 2, removing the sunset date on the statute, which clarifies that it is not a crime to possess sterile syringes and hypodermic needles for personal use. In doing so, this bill will reaffirm California's commitment to research-driven and effective HIV and hepatitis prevention and ensure that Californians continue to have access to sterile syringes. With me to testify in support of the bill is Michelle Rivas on behalf of the California Pharmacists Association and Mr. Alex Kroll, did I pronounce that right? An epidemiologist from RTI with expertise in community-based research and syringe programs.
Thank you. Thank you. You'll each have 2 minutes.
Thank you. Chair Bonta and members of the committee, Michelle Rivas with CPHA. The California Pharmacists Association is pleased to serve as a co-sponsor of AB 309 and appreciates the opportunity to address you today. Current law allows pharmacists to provide hypodermic needles and syringes without prescriptions to adults. AB 309 proposes to eliminate the current sunset provision. This is an essential component of the state's comprehensive public health strategy to prevent the transmission of HIV, hepatitis B, and hepatitis C. For individuals struggling with addiction, the ability to purchase syringes at a community pharmacy provides a critical harm reduction resource. Beyond reducing the spread of infectious disease, the access enables pharmacies to engage with individuals and offer information about drug counseling services, potentially guiding them towards recovery. I think that's an important component of this legislation, is those counseling services that are required. Additionally, it is not uncommon for patients receiving medications via mail order pharmacies to be left without the necessary syringes for administering treatments such as insulin, progesterone, or hormone therapy. Ensuring that patients can obtain syringes without a prescription at a community pharmacy along with proper guidance on injection techniques is essential for their safety and adherence to prescribed treatments. We respectfully request your support of AB 309. Thank you.
Good afternoon, Chair and Committee. My name is Alex Kroll. I'm a Distinguished Fellow in the Oakland office of the Research Triangle Institute here in Oakland. I received my master's from Harvard and my PhD from UC Berkeley, both in epidemiology. I've been conducting research in California now for 3 decades on drug use and infectious diseases specifically, published over 230 papers in peer-reviewed journals, of which 90 of those are on HIV, 25 of them are on hepatitis, and 9 are actually specifically on pharmacy sales of syringes and infectious diseases. In fact, 20 years ago, I was part of the team that evaluated the pilot project for this. That was a California Department of Public Health evaluation, which is a 5-year study that we did at the time. It basically we studied counties that had safe and legal access to syringes at pharmacies versus those that didn't. And what we find, first of all, we found that there was actually no negative effects of this. There was no differences in rates of drugs, drug use, drug sales, or infectious diseases by the counties that we looked at. And then second of all, we found that among the people who used drugs in those counties, the ones that had the pharmacy sales were much less likely to share syringes. So that's a really good thing. Nearly 5,000 Californians every year now still are getting HIV, but less than 400 of them are actually people injecting drugs. And I think this is a big piece of this is both pharmacy sales as well as syringe service program sales that have been giving people access to sterile syringes. Our local studies, national studies, and international studies, there have been hundreds of studies on this issue. All of them show positive things regarding infectious diseases and no negative outcomes at this point. And so I also urge you to eliminate the sunset such that Californians can permanently benefit from this particular intervention. Thank you.
Thank you. Are there other witnesses in support? Please come forward, state your name, organization, and position on the bill.
Aubrey Rodriguez with ACLU California Action and proud support.
Andy Liebenbaum, County of Los Angeles, in support.
Good afternoon. Glenn Backus for Drug Policy Alliance, proud co-sponsor.
Isabella Argueta with the Health Officers Association of California, also a proud co-sponsor.
Angela Hill with the California Medical Association, in support.
Greg Polster on behalf of Equality California, in support.
Good afternoon, Norma Palacios, and I'd like to read the name of the following organizations in support of AB 309. Maternal and Child Health Access, Life Foundation, Hope in the Valley, National Harm Reduction Coalition, Rubicon Program, Citizens for Choice, Health Right 360, Needle Exchange Emergency Distribution, Being Alive, and the Gubio Project. Thank you.
Thank you, Madam Chair. Jean Hurst here today on behalf of the Board of Supervisors of the County of Santa Clara, in support.
Farrah McDade Ting on behalf of the County Health Executives Association of California, in support.
Maria Jose Vides here on behalf of the Vera Institute of Justice, in support.
Trent Murphy here representing the California Association of Alcohol and Drug Program Executives, in support. Thank you.
Ryan Souza on behalf of APLA Health and San Francisco AIDS Foundation, in support.
Jorge Cruz with the California Behavioral Health Association, in support.
Jen Chase on behalf of the University of California, in support.
Madam Chair, members, Rand Martin on behalf of the AIDS Healthcare Foundation, in strong support of this bill. Thank you.
Tara Gamboa Eastman with the Steinberg Institute, in support.
Molly Mala, Planned Parenthood Affiliates of California, in support.
Ted Madden, representing the California chapter of the American College of Emergency Physicians, in support.
And I'm Laura Thomas with the San Francisco AIDS Foundation, a co-sponsor, in support.
Thank you. Before moving on, we are going to establish quorum. Secretary, please call the roll.
Bonta.
Here.
Chen. Addis. Aguirre-Curry.
Here.
Arambula.
Here.
Carrillo.
Here.
Flora. Gonzalez. Krell. Patel. Rodriguez. Sanchez. Schiavo. Sharp Collins. Stephanie.
Quorum is established. Are there any witnesses, primary witnesses in opposition? Please come forward. Thank you. You'll have 2 minutes.
Good afternoon, Madam Chair and members. Ryan Sherman with the California Narcotic Officers Association. I wanted to apologize for submitting our letter late, but I did want to pass along our association's concerns. California Narcotic Officers Association remains philosophically opposed to needle exchange and distribution programs. On a daily basis, our officers witness firsthand the devastation caused by narcotic addiction. Making it easier for addicts to inject their deadly drugs makes no sense to us, those on the front line of this epidemic. especially in light of overwhelming passage of Prop 36, where voters demanded more accountability for drug offenders, not less. For these and the other reasons stated in our letter, we respectfully oppose AB 308.
Thank you. Are there any other witnesses who would like to offer me toos in opposition? Seeing none, we will bring it back to the committee for questions or comments. Moved by Arambula, seconded by Aguirre Curry. Assembly member, would you like to close?
Respectfully ask for your aye vote.
Thank you so much. I think for decades we know that we've been fighting in with public health research that demonstrates that access to sterile syringes reduces HIV, engages people in treatment, and does not increase crime in the surrounding areas. It's time our law acknowledges that these successes and removes any uncertainty about future access. And I want to thank you for bringing forward this bill.
Thank you.
Secretary, please call the roll.
The motion is due pass to appropriations. Bonta.
Aye.
Bonta, aye. Chen. Addis. Aguirre Curry.
Aye.
Aguirre Curry, aye. Arambula. Arambula, aye. Carrillo. Carrillo, aye. Flora. Gonzalez. Krell. Krell, aye. Patel. Rodriguez. Sanchez. Sanchez, no. Schiavo. Schiavo, aye. Sharp Collins. Stephanie. Stephanie, aye.
That measures on call, Assembly member. Thank you.
Thank you very much.
We're going to move on